All right, everyone, welcome to the Coalition for Affordable Housing and Transit. Today, we will be talking about housing, homelessness, and healthcare in Durham with guest speakers Russ Pierce, Donna Carrington, and Oshel, and our moderator will be Terry Allebaugh. But before that, I invite us all to introduce ourselves in the chat. My name is Brianna. I'm your facilitator and tech support for today. I'm with Duke Chapel and the Coalition for Affordable Housing and Transit. I do ask everyone to keep themselves on mute unless it's your turn to speak, because we'll have a lot of presenters today and want to make sure everyone gets heard. Please put your questions that you have in the chat, but we're really happy that you're here. So with all that ado, I am really excited to meet our spotlight for this month from Buildable Backyards with Sherry Taylor, who's the asset manager for the Durham Community Land Trust. So Sherry, I thought I saw you. So go ahead and tell us more about what you're doing.
Thank you. Good afternoon, everyone. Again, Sherry Taylor, asset manager from Durham Community Land Trustees. And we have started an initiative called CLT+1. And that is an initiative that will pair a new land trust home with an ADU on the same property. And the reason that we are looking at this is because, as you know, more affordable housing is needed in Durham. And also the prices of land are becoming quite high. So I've been with the organization a little bit over a year, and I started to look at our portfolio. Accessory dwelling units are now allowed in Durham. And so we wanted to figure out a way to incorporate that into our developments. That's where Buildable Backyards comes in. We wanted to learn from people that have already done this, nonprofits that have already done this. And so we organized a summit. It actually took place last month. It was 2 half days, but we had experts from the fields of real estate and appraisal, nonprofit work, development, to show us more how nonprofits and land trusts like DCLT could really incorporate this into our work and have it work for us. I'm going to place the website in the chat in just a second, but we did this. It was very successful. We learned a lot. And so that's really going to influence how we put our CLT+1 program together. Because what we're doing is we get a 2-for-1 here. We get an affordable land trust homeowner and an affordable rental on the same lot. We have about 6 more months of our pilot program to put this together. So what we're doing right now is we're fundraising for the CLT+1 project. You can find out more about that on our website and on the Buildable Backyards website. But we don't see this summit as being a one-time thing. Obviously, there's a lot more to learn as nonprofits continue to get into this work, and as jurisdictions all over the country now allow accessory dwelling units. So I just want to give an update about that. We're really excited, and hopefully we'll be able to start construction on our first CLT+1 home in 2022. I don't know if there's any short questions I can answer, but I think I have maybe a minute or two I could answer a question if someone has one. But if not, I will hand it back to you, Bree. Thank you so much.
Thanks. Does anyone have a question? All right. So I'm going to go ahead and turn it over to our facilitator, Mr. Terry Allebaugh, to go ahead and start his presentations and introduce our guest speakers. So thank you so much for your time.
And go ahead and put up the slideshow. We're real pleased to have this coming out event for a new committee of the coalition that is focusing in on the intersection between healthcare, homelessness, and housing. We're pleased to have some members of our committee that will be presenting today. Bree did introduce them. Russ is with the is Director of Housing for New Hope. Donna is the Director of Community Empowerment. and Oshel is the Executive Senior Vice President for Alliance Health. And I'm Terry Allebaugh, a community elder, especially focusing on homelessness and housing issues. And next slide. And so the mission that we're about here is to, I'll just read it out here, is to create a platform starting today for discussion where we want to seek innovative solutions and provide input to elected officials and the public on matters of public policy and funding related to the intersection of these three domains. And so with that, we'll just jump right in and go to our first presenter, Russ Pierce, and move on to the next slide.
Good morning. Wanted to share just a little bit of background of really how we've gotten to the point where we now find ourselves working to create this committee. And not surprisingly, the key catalyst for us for a lot of discussions really was around responding to COVID-19. And at first, this was all very much tactical responses necessitated by the situation. So you may know that in March of 2020, a decision was made to relocate Urban Ministries of Durham's shelter from their site downtown to the Marriott at RTP for safety reasons and in response to COVID. A group gathered around them from a number of nonprofits, also from the city and county and emergency management, to figure out what that would really look like and how we would make that work. They were there for 3 or 4 months. There then was a shift back partially to the shelter and also to the motel Carolina Duke Inn, which is still in use at this point. So we gathered first around that, a very, very immediate need. We also then in the late summer, early fall, realized that our normal plans for white flag or warming shelter, and I should say exactly what that is, on nights when it is too cold for folks to safely stay outside, even if they normally choose to do that, we activate plans to create more space for folks to come indoors, even on a temporary basis. UMD was not going to be able to do that. Durham Rescue Mission also often does quite a bit, but they had to significantly reduce their capacity. So again, Housing for New Hope and others gathered together to look at our options. We made use of the street outreach team, we'll talk about a little bit more in a moment, partnered with UMD again for a period, and also with Open Table Ministry to create a plan that got us through March safely. We also, as with many things, there is a lot of funding coming to the city and the county to respond to needs of those who are experiencing homelessness. And so we would gather again a lot of the leadership from across the community in these areas to try and find the most strategic needs. And sometimes really at the beginning, some very tactical pieces. How do we make sure we've got the funding to keep the shelter going in a hybrid model? How do we make sure we have the funding to run white flag in a completely different way? What was interesting was there are a lot of folks who are willing to jump in and help. And so what we realized by June of 2020 was happening was there was basically a healthcare and homelessness conversation happening on Mondays that Dr. Jake Feigl from Lincoln Community Health Center was hosting. And then a conversation that I was tending to host on housing and homelessness that was looking at some of the other issues. And we realized that there needed to be more coordination and that there would come a time when the tactical responses weren't the main focus, but that we should be moving over more quickly to looking at strategic responses. Let's move on to the next slide, if we could, please. So I want to highlight just real quickly, we are, not surprisingly, I think we're all pretty aware of this, dealing with multiple crises. We have the COVID-19 crisis. And one of the ways that this played out in a very challenging way was finding housing for those who were positive, who were awaiting test results, or had had an exposure among those who are experiencing homelessness. And one of our key partners in all this was the Durham Homeless Care Transitions Project Access organization. And you can see some of their data there. It was very hard, and we had many conversations, and many of you on this call were part of that, to find housing because there was just such limitations, but we were able to assist quite a few folks in that period. Next slide. We are aware that we are in an affordable housing crisis, but one of the numbers that really has helped this set in for us at Housing for New Hope and some partner agencies is from September 19 to September 20, the increase in the rental costs for 2-bedroom and 1-bedroom units, which you see there on your screen. One of the pieces that somebody pointed out to us the other day when we were sharing this info was, this is before Google said they were coming, and this is before Apple said they were coming. So we were already in this level of crisis beforehand, and that was affecting everything. Next slide. We also continue in a crisis related to homelessness and just the sheer number of folks who are reaching out for support and help related to homelessness. This past year, our PIT count, which is the point in time count that happens at the end of every January, it's a HUD requirement. There were 391 folks who were experiencing homelessness at that point. If you go to the next slide, you need to see the relative numbers there. So if you see the yellow portion of the bars, that is folks who are unsheltered. Now, part of that is increased because we have better systems, I think, at this point to identify folks and follow up with them. But nevertheless, it's still a significant increase that we're seeing over the years, and obviously also seeing increases in the blue bar of folks who are actually in the shelter. Let's move another slide forward. The other piece that's really important that we continue to monitor, and if you go back and look at these slides later when you have some more time, you'll see that the proportion of the population experiencing homelessness that seeks help is disproportionately African American. We are looking often at a 65 to 70% representation of African Americans in the overall numbers of folks who are coming and seeking help. And that is relative, of course, to an overall population of 38 to 40% here in the community. We can move on to our final slide. So one of the pieces, again, we've really looked at is we had a lot of tactical responses early on, but we are starting to look more strategically at how do we move forward out of the things that we have learned and out of the emerging needs that we have been able to identify. We continue to work to enhance street outreach in creative ways in partnership with the city and the county. We're looking at additional partnerships, potentially with Alliance and others, where we would add some clinicians into the team in order to more robustly respond to folks' needs that are experiencing homelessness and are on the streets. We continue to work through opportunities with coordinated entry, and Donna will dig into that more fully in just a moment, because it is the way that we, in a sense, ration out the support and help that is available. We continue to look at what happens when we leave the hybrid model that we have now at the Carolina Duke Inn and at the downtown UMD shelter, and don't have Carolina Duke as a possibility. Does someone find a way to buy a hotel here that we could convert in order to look at a very different model of emergency shelter? And then the last piece is really around supportive housing, which is a really good example of some of the ways that we are working to really work across silos, because we are in a situation, not surprisingly, where we have one part of the federal government that will give us one definition of homelessness, another that will give us another, one that will give us another definition of what supportive housing looks like, another gives us another. And what we are trying to find ways to do is move past those barriers to create better, more comprehensive solutions. And supportive housing is one of those, because we already know in our community that we need another 125 units. As of today, we could use immediately another 125 units of supportive housing to support those who have been chronically homeless for an extended period. You shift it over to Donna.
Hi, everyone. So I'm going to talk about our coordination system in Durham. Our coordination system is called a continuum of care, and it seeks to prevent, reduce, and end homelessness through effective and coordinated community-wide efforts and services. Next slide. The goal of our continuum of care, or COC, is to promote community-wide goals to end homelessness, provide funding to quickly rehouse homeless people while minimizing trauma and dislocation, promote access to and effective use of mainstream programs by homeless individuals and families, and optimize self-sufficiency among those individuals and families experiencing homelessness. Next slide. So our continuum care has a coordinated entry process. This is a process that everyone that is homeless or literal homeless or facing housing instability would enter through a single portal entry. It is called Entry Point. You call Entry Point and they talk to you and assess the types of housing and services you need. They try to connect you to resources. They are operated by the Department of Social Services and Volunteers of America. Next slide. These are some of the things that Entry Point can use to try to prioritize what is going to happen to a person going through the system. So some of the first things they do is to see if they can do rapid resolution, which is a way of doing diversion and exit strategies to try to avoid homelessness if possible. Also, the next thing could be emergency shelter, referral to those. They keep the list and know the numbers of empty beds daily. They could be connecting someone to rapid rehousing. They also could be trying to connect someone to permanent supportive housing. Next slide. Through this process, the assessment tool that is used in our area is called the VISPADAT. It is an assessment tool to try to prioritize the most vulnerable, including those that have traumatic impacts. There are, of course, issues with the VISPADAT that are coming out in different data across the country, but also even coming out in our system, which is there is a strong evidence of racial and gender bias. So white women are nearly 3 times as likely to report being homeless due to trauma as compared to Black men. Overall, white women have the highest vulnerability scores, followed by white men, Black women, and lastly, Black men. And these could be, some of the problems with this could be indicated with the test, the tester, or sometimes the reluctance of the person to share the information. Some of the questions are highly vulnerable and personal, and could be perceived by a person as something that could get them in trouble or something that could add problems to their families. Next slide. So what is needed in order for us to have better prioritization in Durham? So there is a committee that has formed to look at the coordinated system and to see what the community that is dealing with this feels like the problems are. So we're looking at some strategies to address underreporting of trauma and vulnerability factors, especially among Black, Indigenous people of color. We're looking to more accurately determine the healthcare needs and linkage to services, and definitely more supportive housing, which leads to Anne's slides.
Thank you. I'm Ann Oshel, the Senior Vice President of Community Health and Wellbeing at Alliance Health. We are the LME MCO, managed care organization that provides mental health, substance use, and developmental disability services for the citizens of Durham who are eligible for Medicaid or who are uninsured. So I'm going to spend the next couple of minutes focusing on the opportunities and potential when we really integrate some of the things that Russ and Donna have been talking about with healthcare. Because about 15 years ago, my typical day in healthcare is really thinking about disease management and provider rates and Medicaid regulations and coverage plans and engaging people to stay out of emergency departments. And about 15 years ago, I met Terry Allebaugh. And I, over the last decade, have spent my time thinking about all of those, but but in the context of the environmental risk factors in which people live their lives, which is known to us as the blind side of medicine, expecting that we come in, we treat people with medications, we do labs, we do tests, we do all this stuff, and yet we don't always think about kind of people that are clinically complicated who also live in complicated environments. And so this is one of my kind of favorite quotes that I always start this conversation from a healthcare perspective with, that even back in 2008 through the World Health Organization, there was an acknowledgement that poverty and mental health and addiction and health issues the trajectory and the outcomes of those could be entirely changed with a housing intervention. Next slide, please. So this just gives an example of kind of some of the national conversations focusing on health and housing partnerships. And I will tell you, we are not kind of like organically grown together. This is not a natural collaboration. You have to work at it. You have to work to understand each other. But in some of this work, we all want the same things as a community. We want to reduce homelessness. We want to keep people out of our hospitals and emergency departments if they don't need to be there. We want to keep people out of institutional care. We want stable tenancy for vulnerable citizens. We want better health outcomes. We want reduced public costs. We all want the same things, even if we work in systems that are so regulated and siloed that it's hard and it's a challenge to see how to get there. And so I wanted to give a few examples, and we'll talk in a minute about just how to forge these partnerships. But one of the things that I really like about kind of what's happening across the country is every community has to decide how it's going to solve its own problem. But it also doesn't take a lot. We're not talking about kind of building hundreds and hundreds of units for vulnerable citizens. We're really showing that if we have some intention and focus in the right way on the right people with the right support systems, we can make an impact pretty quickly. It is still complicated, but we can make an impact pretty quickly. And we just have to have kind of the creativity and the innovativeness and the fortitude to figure it out. And I will say this about Durham, because I think that there's already kind of wonderful examples of partnerships through the Healthcare for the Homeless, through the homeless care transition teams. Alliance itself have made capital investments in affordable housing in Durham to almost $2.5 million over the last several years. We'll talk in a minute about a program that we have in partnership with Duke. Our challenge is, and some of why we're here today, talking to you, and there's definitely kind of the political will. If any community can do what we're talking about, Durham can, but a lot of these programs that are on the ground, we don't have the ability to take them to scale. We don't have the ability to expand the populations that they could potentially serve. We don't have the policy support and the shared funding and financing to have a greater impact than what we're already doing. It is people on the ground doing a lot of workarounds to our systems, but there's already great things that are happening that we could capitalize on. Next slide, please. So without a doubt, housing is the best medicine. The Robert Wood Johnson Foundation several years ago did a survey of a few thousand physicians and said, if you could write a prescription for some type of social need, what would you write a prescription for? And the vast majority of physicians said, I would really want to write a prescription for housing and education. People have to have livable wages and in order to support themselves. But this is also kind of another quote of when when healthcare reaches outside of its own walls and we really think about buying health as opposed to just health care, then a whole other facet of what it takes to improve somebody's quality of life and to treat highly treatable conditions that you can't treat when somebody's under a bridge or in a car. You just can't. People are not going to show up for appointments for their antipsychotic injection if they're under a bridge. So next slide, please. So we took this inspiration from the Robert Wood Johnson survey and said, I wonder how we could work with a few champions on the healthcare side and literally, if they would write a prescription for housing, we could take that prescription and translate it into a voucher. So long story to this, but we're 4 years now into this partnership between Duke and the Resources for Human Development with county funding. So the position that is that we use for the supportive housing case manager is funded by the county. And Alliance has brokered vouchers with the Durham Housing Authority. So when you look at what we've been able to do with minimal cost, but I will also say there is a sizable waiting list. So this is by no means kind of everybody that is eligible for the program that we would want to have in housing. It is kind of the best that we've been able to do with really limited funding, but you can see the impact in just a little bit of time. Next slide, please. And this is just to give you some idea of what it looks like when we integrate mental health and physical health into housing. So this is just some clinical snapshots of the people that we've served in the program. I mean, incredibly severe and persistent and costly chronic conditions. The amputation of lower extremities is from 2 gentlemen who had frostbite from living outside. Next slide, please. So I just want to kind of have a quick comment on why this isn't easy, but it's worth it. You know, when you think about kind of the healthcare system and the housing system and the homeless system, each in its own pillar, they are all highly regulated and complex systems. I mean, trying to figure out tax credits with, you know, supportive housing with, you know, target populations in and of itself, tenant selection plans can just be like, okay, boy, we'll save this for another day until you figure it out. So we all come from these very highly regulated. People get frustrated with the healthcare system, understandably. We are ruled and bound by HIPAA. And, you know, and so even that data sharing and that information sharing, but we've already figured out kind of strategies to work around that. And we have in place with Duke a universal consent that we used during COVID for people in the emergency department who needed to access supports during quarantine. So it can be done. It took us a year of figuring it out, and it took us another year to get it through everybody's attorneys, but we figured it out. And so these are just some other examples. The last bullet is one that I would really want to highlight as part of our work. Medicaid is a significant payer of healthcare. So when you think about the opportunities of this integration and collaboration and, you know, kind of the consequences of too much fragmented systems and siloed thinking, you know, when Russ said supportive housing, how that translates in the homeless world is case management. How that translates in our world is treatment providers. How are they being seen by primary care? How are they seen by a therapist? How are they seen by a psychiatrist? So the overlay of Medicaid and healthcare into kind of the treatment wraparound supports of supportive housing is, I think, the greatest potential that we could realize through some of this work.
Okay, thank you, Ann. I would like to say that as Russ introduced it, we were using this COVID response as our takeoff point to move into this analysis, into this understanding of the intersection of healthcare, homelessness, and housing. I've lost my PowerPoint screen. I'm not sure where it went, but hang on just one second here and I'll pull up my own. There, it's back. All right. That it's noteworthy that we have a lot of good things happening in Durham right now, and our COVID response was noteworthy, not only in addition to the stats and information that Russ presented. The homeless care transitions team reports that there was no one who died who was experiencing homelessness of COVID. And given the challenges, that's a remarkable piece of information, which really talks to, even when it's difficult, we can strive to work together. And so as we move ahead, we really want to promote this continued movement through homelessness into affordable housing with adequate and the right kind of healthcare supports. We want to support what is already the ongoing rework of coordinated entry. There's a committee that has already identified the problem with this assessment tool and is working on solutions right now. And Donna serves on that committee. We want to encourage the development of these collaborative efforts that works across silos, that is not daunted by the fact that we might have to have braided funding that has sometimes competing purposes, but to work through the hardship, the difficulty of that. We want to advocate with the Durham Affordable Advisory Committee, Implementation Committee on how to work to leverage dollars with our local affordable housing dollars so that we get better services for people as they move into housing. And last, we want to invite you all, if you're interested, to join CH3 and be a part of our team. And it doesn't matter if you don't know a lot of the intricacies of homelessness and housing. We can provide some orientation. We'd be glad to have you, and you can email me at that address if you're interested. And we have some time for questions. I see some things that are in the chat, and I want to thank Russ has responded to some of the questions already about that through the outreach work, people do not have to go through this coordinated entry system. They can provide that access. So it's really been great that the city has funded the street outreach team that is under the direction of Housing for New Hope. And also want to thank Donna for posting the number that one calls to access entry point. And I want to now open the floor for others who have questions or comments about, for any of the presenters. I guess you can raise your hand on reactions down here at the bottom right. There's a little thing to raise your hand. I can't see everybody because not everybody's on the same screen.
The coalition's having its meeting and stuff like that. But
and I'm hearing Wib talking, so you might mute yourself, Wib. So the question was, does CH3 have regular meetings, and when volunteer jobs need to be done? Well, I think I gave you the broad overview, Becky, of what those tasks that we're going to be doing. We have been meeting as a small committee, and depending on what kind of response that we have of people that would like to join in our efforts, we'd be setting a new meeting time. So we don't have any set time now, so just welcome people's inquiries to what they might do and how they might support these efforts. Certainly, we anticipate coming back to this group in months forward with endorsements of particular project ideas that are moving forward that integrate these principles that we've laid out. So question here, with all this action, do you know why the issue continues to grow? Any of my cohorts want to take that on? Just unmute yourself and see if you can provide Rosa some understanding of why we continue to be besieged by this problem despite our great efforts. Russ?
Well, in terms of moving folks into housing, so I'll speak from the Housing for New Hope perspective because we also operate the majority of the rapid rehousing in the community. It is next to impossible at this point to secure housing for folks who are coming into our programs. I mean, we are working with a number of other agencies. We have additional funding from the state level from North Carolina Coalition on Homelessness, specifically to work with landlords. And even that, even with a lot of funding behind it, it is incredibly challenging. One of the things I've shared with some folks is that, you know, in one of our permanent supportive housing programs is partners with landlords, and then we provide the case management and the rental support for an ongoing long period. And this past year, we have suddenly been getting calls from real estate agents saying, you know, we're working with someone who's about to buy a property, and it shows in the lease that you're somehow connected to the person that's there, and we're looking to transition this even before they've bought it. And we weren't necessarily having that experience before. So, I mean, that intensification that we see on the market is just, it's creating intense downward pressure. So it's just getting more and more difficult, even when we literally have money to throw at the issue in terms of incentives. So that, at least on that is one piece of it. Then, of course, the other issue has continued to be access to jobs that in some cases that you can even get to. I mean, I know I've heard folks from urban ministries talk before. I mean, this will not be new news, likely to you all with the work that you do. But they'll have folks that get jobs down in the RTP making $15, $16, $18 an hour. This is pre-pandemic levels. And a 2-hour bus ride down and a 2-hour bus ride back is just not manageable. So they're not able to maintain that. So, you know, I think one of the pieces we're looking at is how do we find, you know, obviously continue to work on the better transit piece, but do we find ways to get more affordable housing in a broader set of places near the jobs? Let me stop
I
there
would
because
just
there's other
kind of
aspects. Yeah.
quickly add to what Russ said, you know, two things. One, you know, some of the people that we're talking about have high housing barriers. So they might have a criminal record that would cause a landlord some pause. They have insufficient income. You know, we are all fair housing advocates, but housing discrimination still happens. The other thing is the preservation of affordable housing. So, you know, long ago, even I figured out we are not going to be able to buy our way out of this problem. We have to preserve the affordable housing that currently exists. And that's where Alliance has made some of its investments is in the rehab and acquisition of current affordable housing. We also have 2 supportive housing programs in Durham that serve 32 people, and both of those properties were sold. And so we are going to have to figure out where we relocate 32 people out of our supportive housing programs because the new owner will have costs that are not affordable to us any longer.
Thank you, Russ and Ann. I see another question from Mayor Steve Schul. Do you have a sense yet of the range of resources that will be needed, both on the housing and services side? How much money are we talking about? We don't have a dollar figure on that. I think we have a very broad understanding and we're now ready to make that more specific, especially as projects come forward. But I also want to invite Ann maybe to speak the particulars of that, of what she has seen with some of the national models, as well as just locally what's needed from your test model.
Well, you know, we would be happy to talk to you and Wanda and your counterparts on the county side of this. And I think now's the time. I mean, one, COVID has elevated something that we've known all along around inequities and health disparities. So, you know, it is carpe diem to see some of the momentum and the resources brought to our communities by COVID, but and I think the greatest opportunity is to do this in a much more kind of coordinated, sustainable way. And in the state of North Carolina, even without Medicaid expansion, which still just, even without Medicaid expansion, Medicaid has taken some strides even since January that have more payment mechanisms directly related to supportive housing. So instead of us coming to our local governments and saying, well, you have to fund these positions, you have to subsidize this rent, you have to do this, Medicaid is coming in as a payer now of that, which is, again, why we are just kind of hanging the banner of the importance of thinking about this in a much more holistic way. Because we want to be good stewards of public money and we want to think about kind of where we get the best outcomes.
The research done by Community Development Department has shown just a great need of supportive housing to respond to homelessness. And we have some evidence best practices, not only from Durham, but other communities that shows that a very effective tool at working toward ending homelessness. And so we would like to see more of those kind of models come forward. And as they come forward, to make sure that we are fully leveraging the resources of our medical systems around us, as well as our various healthcare providers, not only provide that direct healthcare, but also there can be things that are promoting good health within housing developments. I mean, some of the existing things we know, like parks and gardens, but also there's places where a clinic would be helpful. because of the healthcare needs there. So there's a lot of ways to move this forward, and we look forward to getting some particulars to you, Mr. Mayor, as well as City Manager Page about how we can best move this forward. But thank you for that question. I think we got time for maybe one or two more, and then we'll need to move on to the other part of the coalition's agenda today. I see a note from Mimi Kessler. First, it's remarkable that none of our homeless died of COVID, and that is something to celebrate. And I can tell you, there's lots of people that deserve credit that have worked there, and probably no one more than Julia Gamble, who has really done amazing work on the front lines, ensuring not only that people who had COVID and were at risk of COVID got into housing, but was able to help assist many others that didn't even go into the county supported housing. And we all owe her, as well as Sally Wilson at the Project Access, a great debt of service. They did a great job on behalf of our community and with our support. Last question, if anybody has one. If not, we look forward to working under the guidance of the coalition, and look forward to coming back with you with particular ask and recommendations for your support. And we'll close out by thanking you for your attention. I think Becky or one of the others will be sending out the PowerPoint afterwards, so you can consult that. And again, you can also, if you want to be a part of it, you can email me. All right, with that, we'll close out, and I'll hand it back over to Bree.
Thank you, Terry. Thank you all of our presenters today. That was really informative and helpful. Now we're moving on to our updates section of our agenda, and I believe Jim Sparra is first. Jim, do you have some updates for us on affordable housing along the Beltline?
Yes, the Beltline project, the empty railroad track that goes winds from the central bus station, central train station around Trinity to Avondale. There is a plan to turn that into a biking, hiking trail. And currently, if a request is being made for federal funding, we were asked to endorse the proposal, and decided through the policy committee and the coordinating committee that we would provide our endorsement, but we also are focusing, drawing attention to the need to look at the details of the plan for the Beltline to find out how many residents are already in place in affordable housing, and how can they be protected in the future. Also, what are the opportunities along the Beltline for new affordable housing? There is a substantial amount of land that's underutilized, but there is currently no census that's been done of residents that face potential problems when rents get pushed up even more than they are being pushed up because of the economic conditions, and also plans for where and how the affordable housing could be built. So we need to pay attention to this issue and help make certain that this is moving forward as we wait to hear about the construction grant proposal.
Thank you, Jim. John, do you have an update for us on transit equity?
Yes, thank you, Bree. As most of you know, the county, the city, Go Triangle, and the regional transportation planning group called Durham Chapel Hill Carborough Metropolitan Planning Organization are in the midst of developing a county transit plan to prioritize investments for the transit taxes collected half-cent on sales of most things in the county of Durham. And it will raise up over 20 years, about $1 billion. About half of that is already committed to a variety of projects. So it's programming about $500 million. Last week, the group, the public sector group, released transit options as an outreach technique. And I'm going to put in the chat a link to the webpage on Engage Durham that has information about the transit options. We will be digging into that. The Transit Equity Campaign will be digging into that to get an understanding and plan some educational activities. We're also canvassing down at Durham Station so that we've got contact information for transit riders to be able to share the information with them directly and encourage them to read this and fill out the survey themselves. So we'll be providing more information probably through the email list in the coming weeks.
Thank you, John. And we're back to Jim with longtime homeowner tax assistance.
I'm sure that we know from previous meetings that the city and the county have endorsed the county's proposal for a tax assistance grant program that will provide a payment of up to half of the property tax bill, up to a limit of $750 each year for longtime homeowners with income below 30% of the area median income. We're very encouraged to finally see this program in place, and we will pay attention to and promote efforts to expand it. The city council is also discussing the possibility of continuing its longtime homeowners grant program for another year. Remember, this program pays taxes that have already been paid. There are currently applications being accepted through the end of August for the extra tax paid in 2019, 2 years back. And the council is considering whether or not they can expand the program to cover the extra taxes paid in 2020. This is particularly important because in 2020, after another property reassessment, tax bills went up even more. As I understand from the council meeting on June 21st, there will be a report at a work session in August. Not a proposal, but what it would take to put together a proposal, whether it's feasible for the city to carry out this approach. It would help people who had financial difficulty during the pandemic and provide a grant that could be put in place for this fall, provide a grant that could help them pay their current tax bill in addition to the county city tax grant program. So we look forward to hearing what is shared with the city council in a few weeks.
Thank you, Jim. And last but not least, we have an update on the Durham Housing Authority with Dan Hudgens.
Thanks, Brianna. The only thing I want to report this month is that at the June meeting of the board of the Housing Authority, the board approved 2 third-party contracts. One to bring in an outside agent or organization to establish a call-in number for anyone who has a maintenance problem. We've had problems assuring that all reports from residents are responded to and to track those calls. And so that will provide the Housing Authority with the ability to, I think, better serve and respond to maintenance calls that are made by residents. The second is a contract for a third-party property management of our newer properties to allow us to put more emphasis on our own property management in our older facilities. And that's also a third-party contract, and they were both approved in June.
Thank you, Dan. So if you have the agenda, just an update reminder that we have last Tuesdays is our policy committee meeting from 5 to 6:30 p.m. All are welcome. You can contact Jim Spara. His email is on the agenda if you need a link to join the meeting. You're also invited to Imagining Real Housing Justice Solutions, a biblical framework. While not all of us are Christians or part of communities of faith as part of the coalition, that is one really big resource we have in our city. And so that's something I've been working on to, along with Lloyd Schmeidler and several other people on this call, to help churches understand what housing justice is, and also just to gather people together from various groups to talk about what we're doing in Durham, what's being done in Pasadena, California, and how we can have those housing justice solutions here in Durham. So it's one of those both and kinds of meetings. It's free. You're welcome to come. And then the next coordinating meeting is always on first Mondays. So August 2nd at noon, you can contact WIB for that. And our next coalition Monday or coalition meeting is third Monday, August 16th from noon to 1 p.m. And we will be attempting to have a hybrid meeting. So more info on that later. If you need to be on the email list or have any more questions, please contact Becky. And I hope all of you have a wonderful day. Enjoy your lunch and take care. Thank you for your time.